What about that coccyx dysfunction? A lot of women have problems with coccyx after childbirth. Sometimes it likes to break backward, which is really not much of a problem when it goes backward. This joint right here, this sacrococcygeal joint, is it's a synovial joint, and it's supposed to have movement. There are 3 or 4 tiny little bones that are part of the coccyx, and when you sit down, the coccyx is supposed to flex forward. This joint's supposed to be mobile, but very commonly it gets osteoarthritic and does not want to flex forward when you sit. The biggest problem that I see in my practice, sometimes toddlers, when they're young, they will fall on a step and it will start to hook this coccyx, and it'll get stuck there like that in what's called a hook coccyx. Very commonly you'll see a hook coccyx co-present with a left side shift. In other words, left side bent coccyx and hook too. That's what I see more, and I have no idea why it goes to the left more than to the right. That's what I see in my practice more. You got to get that out of there somehow. And so there are several good techniques for doing it. Of course, the sacrotuberous ligaments, sacrospinous ligaments have to be released, and I'll show you how to do that. And then we have to get in here and do some muscles that people do not appreciate much, and that's sacrococcygeal, the lateral sacrococcygeal muscle, the medial sacrococcygeal muscle, and of course you got another lateral one on the outside. Then you got these pubococcygeal muscles that come here and form the pelvic floor. They come up here and all attached to form a container for the pelvic floor. All that stuff is important. In women that are having pelvic floor dysfunction, this stuff has all got to be fixed. So here's some very basic technique for dealing with coccyx dysfunction and or pelvic floor dysfunction. I'm going to leave this coccyx sitting up here if that's okay with you, Michelle. What I'm going to do is I'm going to come in here first of all and come across where the sacrotuberous ligaments are going to be, right in here. So I'm going to come off the coccyx and come across and just feel for tension in the sacrotuberous sacrospinous ligament. You guys have done this technique. We've been teaching this for a long time. Everybody teaches sacrotuberous work, so I'm not going to spend much time on that. I just want you to know that you need to come under that first. Come under it and lift all that tissue up. You're trying to lift that whole thing up. Of course, you've evaluated for the coccyx, and you have to come down on the, first of all, make sure you've got a hook coccyx. If you cannot feel the tip of the coccyx, you've got coccyx dysfunction. And Michelle's got a little bit of a hook coccyx here. We're going to try to get this out of here.